The label on your prescription bottle tells you a lot of information about your medication. It can be difficult to decipher what everything means, so it's important to know how to read the label so you can take your medication correctly. This will save you extra trips to the clinic, the pharmacy, and give you the best treatment results. Always take your medication as instructed by your doctor or primary care provider. The label on your prescription will tell you how to take the medication, including how often you should take your medication. For example, this label says to take 1 tablet by mouth daily. How much of the medication you should take. This label tells me to take 1 tablet, but sometimes the label will tell you a certain dose, such as 20 milligrams. If this is the case, the label will also tell you what the medication's strength is, such as a 20 milligram tablet. If you need to take it with food or water, and your pharmacist can also share more about your medication with you. How to take your medication. For example, medications might need to be swallowed, rubbed on your skin, injected, or dissolved in your mouth. The label will also tell you when your prescription was last filled, usually at the top of the label, when the medication expires, and how many refills you have left. If the label says that you have 1 or more refills, like this one does, you can just call the pharmacy to get a refill. No need to call the clinic. But if the label says you have 0 refills left, then you will need to call the clinic to get more. Generally, once you run out of refills, you need to come back to the clinic to check in with your provider. Your care team will want to know how well the medication was working for you, your condition, or your symptoms. If you have questions about your medication, the pharmacy phone number is on the label, and they can usually answer most of your questions. If the pharmacy can't answer your questions, you can always call the clinic. Call with any questions about your medications, especially if you are unsure about what the instructions mean. Getting the direction right is the best way to make sure your medications are safe and are working correctly.